Hi everybody, this is Julissa. Thank you so much for coming back to my channel. Today is Tuesday, September 15, 2020, and I'm here because I want to do a special message. So as you know, if you've been watching my channel for a few days now, for a few months, I guess I can say, you know that I have my mother living right now in a nursing home in the United States, right here in the state of Connecticut, and that's where I'm based. As you know, taking care of a parent is really it's such a hard process, emotionally, physically, and it's just like I'm just saying, like, if you haven't gone through this, it's really hard. Having a sick parent is one of the worst things that can happen to you, because that's something that's out of your hands. When we had to take the big, strong decision to have to place my mother in a nursing home, it was not an easy decision. It was a long, and it's still like it feels sometimes like it's not, because we struggle with them. I mean, me and my family, we struggle with it. It's very hard, but it's sometimes in life there are things that you are not capable of doing, and that's why you need to ask for help. But anyway, speaking about that, I just wanted to say that first, because sometimes people say, when you have to place a parent in a nursing home, you're just cleaning your hands, washing your hands and going on and living your life. And a lot of the times, I must say, that is not the case. Maybe like 90% of the time, that is not the case. Seeing somebody getting sick or like losing their mind is very hard. And you also, like, you struggle with that. You struggle every time, even if let's say, like, she's getting a good care, you still struggle at home because you're not there. You don't see what's happening. So here's the thing. We know that COVID started beginning of the year. Around March 10 or 12, I don't remember exactly, they put restriction on every visitor to have access to the nursing home, because they were trying to control the disease, which is strange because that plan completely failed, and it fell on all the agencies that run the nursing homes right here in the US, because out of all the deaths and all the infected people that got COVID during this pandemic, it happened in a nursing home. But if you think about it, they might say, "Oh, we want to keep the families away because we don't want people bringing in the virus." But you locked down the nursing homes in early March, and then the cases went crazy, and they kept getting more and more cases, more and more death. And are you kidding me? It's not the family. What's happening is that you didn't control it early enough, and then you have employees who work at different nursing homes, and they go out and live their life. Of course, I'm not saying the employees should have lived there, but I'm saying, like, don't blame don't use that as an excuse to stop family members from coming in, when it's much needed for the members. If you haven't gone through this, you cannot probably relate to anything that I'm saying. But if you are, and if you know somebody who is going through something like this, you can totally understand where I'm coming from. We not only we will be there for my mom, during meal times. We try to go there, every night, like I said, for dinner time, and then we will spend the weekend basically there, because we will have more time during the weekends because we don't have to go to work, so we will spend longer time there. So that was like, that was great for my mom to kind of see us and, like, be with us. That will also take work away from the nursing home workers, because we will take care of her. And the other thing too, like, that was also good for us because we got to see our mom and to share with her and be with her. I just don't understand how it feels at times like nobody's doing anything about this. And here we are, September 15, the air is already cold, and there are no plans. And I feel like the health department in the US had let us down, because they wasted the entire summer. Instead of, when all the cases plateauing, everything was like controlled during the summer months, Like, let the family in. Like, are you kidding me? I don't understand how hard it is to have a family member say, you know what, before you come in here, you have to show me your negative COVID test, right? And you have to wear a mask. And yes, if everything works out like that, if you have everything checked off, then you go ahead and you can come in and out, no matter what. But nothing like that is being done. Yet, on the other hand, we are opening restaurants back up, indoor dining. We're opening up the theater. We're opening up, bars and concerts, and like everything is opening back up. Schools, are you kidding me? We're opening back up daycare too. Like newborns are going to daycare, but I cannot go and hug my mom. Like that's crazy to me. And it might sound selfish. It's almost like you're trying to, like, say you want to pull from for your side too, but sometimes you have to, because I feel like it's being forgotten in some way. Every time they do a press release or they talk about, like they say, I don't know if it's the government or the CDC or the Department of Health, every time they talk about COVID and reopening guidelines, they always say that nursing homes are still not opening back up. Okay, but what is the plan? Are you kidding me? It's September. Like, what is the plan? What is your action plan? If you're telling me that I have to go and show my test that says I am negative, and this is a recent test, COVID test, I don't understand why it's so hard for family members to go in. It's almost like there's something else hidden here, and nobody's talking about it. You don't see anybody in Good Morning America talking about it. And they, like, don't blame the family for the death. We were not allowed to go in since March, and all the cases came ranking up in April. So somebody else was bringing that in, and it was the fault of the agency that controlled the nursing homes, and the way they controlled the disease, that they failed. And here we are, all these innocent victims of COVID, because they haven't done anything. They're just there, and they're being infected, and now that everything kind of like it's been settling down in a way, and not a lot of cases are coming up as much. Now they still don't have access. We don't have access to them. They don't have access to us. You know how hard it is to be 6 feet apart from your mom that you haven't been able to hug since March? And somebody who has, let's say, dementia would never understand what's going on. They might take it like, why is my daughter not even coming to me and hugging me? We hear so many complaints from people. We get into these calls, and you hear people saying, my mom doesn't even want to come out anymore for the outside visit. And some are mad and like, are you kidding me? Who is, like, what is the voice? Who is, like, saying, wait a second, well, let's do something for the nursing home patients? So this is why I'm making this video. We need to unite. We need to go on television. We need to do something. Reach out to the president. Go on the website of the president. Google how to write to Donald Trump. Send him an email. Send an email to SEMA, the president of Medicare Services. Send an email to the CDC. Reach out to your government officials. Start writing up letters and say, we need something. Something has to be done. Something has to be done. This is crazy that the nursing homes, they're still in lockdown. It is crazy when you have an employee coming in and out, going on vacation, coming back. Yes, they quarantine for 14 days. Are you telling me a family member that's coughing and sneezing is going to show up for a visitation? I mean, you have to have a very dark heart to even try to do that. If there are no symptoms, you should not, let's say if you have symptoms of COVID or whatever, you should cancel your visit and take 14 days. Any family member will do that, because we don't want our loved ones to get sick. So they're just using the excuse that, we don't want people coming in. Yeah, you have vendors coming in, you have staff coming in, you have everybody's coming in and out, and they get to go and leave. Yet our family members are sitting in their room still, since March. Think about that for 1 second. So if you know anybody who is going through something similar, please share this video, leave a comment. I have no idea what that noise was, but anyways, sorry about that. Leave a comment and let's unite. Let's start getting together, people. Right? I already wrote a petition. I'm gonna leave the link again so we can, get more signatures in it. We need to start banging on doors about this. This is just getting way out of hand. It's out of control. And the people that are paying for this are our loved ones who are sitting in a nursing home right now. Thank you so much for watching. Thank you for subscribing. I gotta find out what's going on around here. Anyways, thank you so much. This is Julissa. Thank you and God bless. Bye.